Did you know that you can get into life-threatening diabetic coma even when your blood glucose is normal? Please allow me to explain. My name is Dr. Ennin, doctorate pharmacist and a functional medicine doctor. And again, welcome to the channel. Today, I am going to be talking specifically about a particular drug that is promoted and being used in the diabetic space. And this group of drugs are called the SGLT2 inhibitors. But before I talk about that, I want to talk about the SGLT2 protein. And this is a protein that is found primarily in the kidneys. And its primary job is to reabsorb glucose and sodium. So when we eat and you have the glucose and everything goes into the bloodstream, it goes inside our kidneys. And 90% of that is reabsorbed. So it reabsorbs glucose and it reabsorbs sodium. And that is why we call it SGLT2 transporter. The SGL2 is sodium glucose co-transporter 2. But for the purposes of this discussion, we'll be using SGLT2. Now, this is a protein. So in the ideal situation, in the ideal world, when we eat and you have high levels of glucose, the kidney filters the glucose and is reabsorbed back into the bloodstream. Now, a clever scientist sat down and realized that if you are able to block this reabsorption of glucose, it can help with our blood sugar. And they came up with a group of drugs called the SGLT2 inhibitors. And this will be the Jardiance, Invokana, Farxiga, and Steglatro. So this group of drugs are called the SGLT2 inhibitors. So what it does is it blocks the reabsorption of sodium and glucose at the proximal tubule of the kidneys. And I want us to appreciate this mechanism. I want us to appreciate the way it works. As a matter of fact, most doctors are promoting this. Most of them promoting this without really understanding the mechanism of action. Anytime glucose is up, insulin goes up. But once we block this reabsorption, there's less glucose in the bloodstream, so it helps us. So once glucose is lowered, insulin is also lowered. And that can lead to weight loss. Because in the presence of high insulin, we store things away and we gain fat. So once insulin is lowered by this mechanism, it causes weight loss. So that is one of the promotions of this drug. So it also inhibits the reabsorption of sodium. So that affects our blood pressure positively. In the cardiovascular space, they are promoting it because it's able to reduce our blood pressure, particularly the diastolic pressure. So these are some of the things that most people are promoting with this. Now let's add in carbohydrates. Right now, American Diabetes Association is prescribing the low-carb diet as one of the ways to help with our blood glucose. What most doctors are not telling their patients is that when you combine low carbohydrate diet with this type of drugs, which is the SGLT2 inhibitors, it can be a problem. Let's talk about the low carb diet for a minute. The low carb diet lowers blood glucose and lowers insulin. And once insulin is lowered, we start burning fat. And once we start burning fat, we start producing ketones. So the low carbohydrate diet lowers glucose, lowers insulin, and burn fat. And burning fat produces ketones. So what really happens when we have this drug combined with a low carbohydrate diet? That's where the danger comes in. Both the drug and the low carb diet will lower insulin and raise ketones. And this can lead to a condition called the euglycemic diabetic ketoacidosis, or EDKA. And this is where your blood becomes dangerously acidic even when your blood sugar is normal. And some of the symptoms that you see with this are nausea, vomiting, abdominal pain, rapid breathing, confusion, and in some cases coma. It's rare, but it's very deadly if mixed. Now, there are other risks that we have to consider when we are combining these two modalities, which is the SGLT2 inhibitors plus the low-carb ketogenic diet. The first one is dehydration. The reason is because both of these causes fluid loss, and this can lower your pressure and also hurt your kidneys. The other thing to also look at or think about is electrolyte imbalances. Both of these will cause fluid loss and cause electrolyte loss like sodium, potassium, and magnesium. And this can lead to cramps, arrhythmias, and foggy thinking. The other thing that we also want to pay attention to is infections. When you combine the low-carb diet with this, it can cause infections because you have sugar in the urine, and this can cause genital and urinary tract infections. In certain species, they can even have an infection called the Phoenix gangrene, where it happens in the perineum. There's the space between your anus and your penis, or your anus and the vagina in females. Also, you can have muscle loss when you're combining these two modalities, which is this drug, the SGLT2 inhibitors, plus the low carbohydrate diet, especially when you are not eating a lot of protein. So now, how do you use these drugs or these medications alongside the low carbohydrate diet? First, let's think about how these drugs work. They block the reabsorption of glucose and sodium. So if we are not overly consuming carbohydrates, we should have limited amount of glucose to be reabsorbed. That's one piece to think about. And the recommendation is for us to go low carb when you have type 2 diabetes. Not too long ago, the American Diabetes Association will not mention low carbohydrate as a way to help with diabetes treatment. Now they have it in their guidelines as a way to help with that. But keep in mind, the job of these particular drugs or medications is to block the reabsorption of glucose and sodium in the proximal tubules of the kidneys. So if you are not overly eating carbohydrates, we don't have that much of glucose for it to be reabsorbed. That's something to think about. The other piece to also think about is, if you are in fact doing that, then we need to be monitoring our ketones. For people in America, even here in America, a lot of people are not even checking their blood glucose the way they are supposed to check it, let alone checking their ketone levels. So in people in deprived areas where they are not even testing their blood glucose, what makes you think that they will be checking their ketones? And these people are at high risk of developing these things that we are talking about, especially when combined with the low carbohydrate diet and if they are on these medications. But in terms of using it safely, the practical way is to be checking your ketone level, especially when you feel sick and you have nausea. The other thing is to stay very hydrated and make sure that you are taking in a lot of electrolytes. The other thing to do when you are on this medication alongside the low carbohydrate diet is to increase your protein intake. Ideally, 2 grams of protein per every kilogram of body weight. And if you're on insulin and other drugs for diabetes, then you want to talk to your primary care doctor or talk to your doctor before you initiate the low carbohydrate diet. So in wrapping up, combining the low carb diet and the SGLT2 inhibitors like the Farxiga, like the Jardiance, like the Invokana, like the Steglatros can be a very powerful tool in the management of type 2 diabetes. But combining these two without supervision is where the risk lies. You need to watch out for the signs, you need to know the symptoms, and work with somebody who understands metabolic health. The best absolute practice, especially if you're on the low carb ketogenic diet, is to stay away from these drugs. And I hope this helps. And if this content resonates, please like, share, and subscribe so that we can keep this conversation going. Stay safe, stay smart, and take control of your health the metabolic way. Thanks for watching. I'll see you in the next video.